this video, I'll be discussing about trigeminal nerve, basically the course of the nerve, and also I'll try to make it easier to understand. Plus, you can use this diagram in pathogenesis of trigeminal neuralgia or tic doulorex or Fothergill's disease. So let's get started. So first of all, we will make the midbrain, the pons, the medulla. All right. Now, I want you to remember there are four nucleuses. Okay, four. So first, let me pick up the colors. Mm, right, great. So the first one lies here, the second one lies here, the third one is quite big, it's this, okay, and one more here. All right. So now I want you to remember their names. So the first one, I'll just label them this way so that it does not get a lot of messy. So right. So the first one is mesencephalic nucleus. The second one is motor nucleus. The third one is the primary nucleus or the pontine nucleus, okay? Or it is the main sensory nucleus. Now, the fourth one, which is the bigger one, is the spinal nucleus. Now, their functions, all right. Now, mesencephalic, it is mainly important because it receives the or the proprioceptive, proprioceptive information from the jaws. Also, it prevents pain while biting, chewing, proprioceptive, okay. Now in motor nucleus, it basically supplies the muscle of mastication worm. So the primary nucleus, it is responsible for basically main sensory conditions like touch and proprioceptive information from head, okay. Now in the spinal nucleus, it will do all except touch, okay. So pain, temperature, and sensations. All right. Now what will happen is we will have certain branches coming out from this. So now this will be, now this where they are meeting is trigeminal ganglion. All right. Now another name of it is Gasserian ganglion. Now this is the MCF ACF. All right. Now what you will see is a branch comes out like this, then there is another branch which comes out to be like this, and then there is another branch which passes through this, and here we have this beautiful eye. All right. Now which is this branch? This is mandibular branch, this is maxillary branch, this is the ophthalmic branch, and this is our orbital fissure, okay. Now this is basically V1, V2, V3. All right. Now what we see is V1 and V2, they both are sensory, whereas V3 is sensory plus motor, okay. Now this can also be labeled as main sensory nerve. All right. Now you can also understand it, the supply, by this diagram. Oh my god, I drew the lips too long or too big. So like suppose we have this, so from the nose first we will draw, and then it will go to like this, right, then it will go like this, I suppose. Oh my god, 1, 2 and 3. So V1, V2, V3. Alright. So I hope you liked the video and you understood the course of trigeminal nerve. Thanks for watching.